Well, hello, everyone, and welcome to the Community Matters Understanding Social Determinants of Health to Reduce Dementia Risk webinar series. Thank you for joining us today. I'm Mikkel Lewis. I'm an Associate Director of Center of Excellence at the Public Health Center of Excellence on Dementia Risk Reduction at the Alzheimer's Association. I would like to take a moment to highlight a local health department opportunity. We do have our Healthy Brain Initiative Roadmap Strategist application open. This is open as a peer cohort of leaders just focused on building capacity and addressing brain health within their health department and communities. This opportunity does provide direct funding, technical assistance, as well as peer support. And the application does close September 26th. So I would highly recommend, if you are interested, please register and sign up for this wonderful opportunity, and we'll also be sure to put this information in the chat. But over the summer, we've discussed economic stability as well as nutrition, but today we're going to talk about social engagement and have our academic expert and our health department speaker help us see how this work is happening into practice. So today, we'll be discussing breaking barriers, combating dementia through social engagement. And this is the third webinar of a 4-part summer series. As we get into this icebreaker, please let us know in the chat where you're listening in from, as well as, do you prefer to start a conversation, or do you prefer someone starts the conversation with you, especially since we're talking about social engagement today. But I would also like to just share that I actually prefer to start the conversation. So I'll be sure to check the chat, and then I'll go through the housekeeping items. So as we get started, I would like to highlight that this webinar is hosted by the Alzheimer's Association Public Health Center of Excellence on Dementia Risk Reduction, and it is funded through a cooperative agreement with the CDC. This webinar is being recorded and shared with all registrants, as well as any personal recordings on this webinar or use of AI assistant to record is not allowed. So unfortunately, we will have to remove those assistants and personal recordings. But if you would like to use closed captioning, please enable the toolbar at the bottom of your screen. And if you don't see it at the bottom of your screen, there is 3 little dots where it will open up a menu, and you should see closed captioning there. As well as, please feel free to use the Q&A box for any questions that you have for our speakers today, and either one of the speakers or someone from the public health team will respond. So a quick overview of the agenda. I'll go through the learning objectives of today's session. Then we will hear from our speakers, and then we will go into the Q&A section. So for today, our learning objectives will focus on hearing from our academic expert on the relationship between social engagement and dementia risk. And then we'll also hear from our health department speaker about the work that's being done within their community. So before I get started, let me just check the chat really quickly. Hello from Georgia, Louisiana, California. I love that a few of you are saying that you prefer to start the conversation. So that's great to hear. But keep in mind, if you don't, we'll give you a few tools to take back with you to really help you with that confidence as well as that knowledge to start great conversations. Without any further ado, I would like to introduce Dr. Crystal Glover. Unfortunately, she could not be here with us live. However, she did take time out of her schedule to pre-record her section of this webinar. But Dr. Glover is an associate professor of psychiatry and behavioral science and neurological sciences at the Rush Alzheimer's Disease Center and Rush Medical College. We'll also hear from Patricia, who is the community health planner, as well as Maya, who's not shown on this slide. However, she will be joining us on video. And she is the community engagement with the Minnesota Department of Health. So without any further ado, I will go ahead and share my screen of Dr. Glover's session.
And next, we'll hear from Dr. Crystal Glover, Associate Professor of Psychiatry and Behavioral Sciences and Neurological Sciences at Rush Alzheimer's Disease Center and Rush Medical College. Dr. Glover, I'm now going to turn it over to you.
Thank you so much. It's such a pleasure to be here with y'all today to talk about the many facets of social activity. So, no matter how brief our time together today, I always like to lay out an agenda or a roadmap so you can know what we're going to discuss. So, we're going to start with defining social engagement, then discussing its impact as a protective factor and how it may be a protective factor, so mechanisms. Then we'll talk about the converse, which is social isolation, and a little bit on loneliness. Lastly, we'll outline the quality and strength of scientific evidence. I'll set forth some strategic next steps, and then I will summarize. So first, I think it's key that we define what do I mean when I say social engagement? There are four big elements. First, it has to be meaningful. That means it has to benefit you. You have to be interested in it. And it's something that you, too, is sustained. So that means it's not a one off activity, something you do every once in a while. Three, it has to include at least one other person, hence it being social. So you have to be involved with another person. And all of this has to be around something shared, an interest, an activity, so something you're doing, or a goal, something that you would like to achieve. Some various examples include a walking group, a book club, or cooking and gardening groups. One thing I must note is that this cannot be a paid activity. So it cannot be, say, your work. You can be very interested in your work. You can maintain relationships with individuals who you work with, but that is not what we mean when we say social engagement. So, social engagement is one of 14 potentially modifiable factors, risk or protective of cognitive impairment. If you join me to your left, you'll see 14 different variables or factors from the time you're little, so early life, midlife, say where I'm at right now, to later life that are important. So addressing these 14 factors may prevent or delay up to 45% of all dementia cases. This is huge as these are potentially modifiable factors. So one of the most important elements being, if you join to the bottom in late life, being social isolation, but the converse being social engagement. This is a key component of healthy, successful aging, well being in older age, and quality of life. But also, I must note that social engagement is oftentimes interrelated with what I call the three acts: social, physical, and cognitive activity. So keep that in mind as we discuss the data. So, we do get to later life, of course, but we go through midlife. And one of the big things is thinking about how is social engagement in middle life impactful for dementia risk in late life? So, what we see in the research is that there is no level of midlife social engagement that's associated with dementia risk in later life. But this is way more nuanced than that. So, two big things to note. Whatever your level is of social activity, social engagement in midlife, as you go into later life, if it decreases, then you are at increased risk of dementia. So that means you must keep your levels at least the same going from midlife to later life in terms of social engagement. Why? That's very important that in later life, if you're more socially engaged, you have more frequent activities, social activity with others around a common interest, goal activity, your risk for dementia is decreased. So that's huge. One, late life, being more socially active, but also maintaining or increasing those levels as you move from mid to later life. So, when I speak about social engagement, and many folks say, well, it's so nebulous. What exactly do I need to do in order for this to have benefits for my cognitive health as I get older? So, looking here at specifically older adults, we noticed, of course, that frequent social engagement is key, especially for reducing risk for early death or death at all. But it was really three big pieces of social engagement: community focused, so focused on individuals that you relate to or you feel as if you belong to, volunteering, so dedicating your time to those individuals and doing so with two or more people. So it's social engagement and is frequent, but doing so community based volunteering in a group has the most bang for the buck. So all of those studies have been largely cross-sectional. So we wanted to see what does it look like in older age specifically? How much time does this buy you in terms of cognitive impairment or cognitive decline? So we noticed that more social activity, less cognitive decline over 5 years. So staying frequently engaged with others in a common goal interest was able to stave off lower levels or have lower levels of cognitive decline for up to 5 years, over 5 years actually. And that this rate of cognitive decline was reduced by 70%. So as older adults are thinking about, and most of us, non-pharmacologic ways to stay healthy in older age, maintain our brain and cognitive health, social engagement is key for this. So, how is this working? What is the mechanism? So, researchers are thinking that is cognitive reserve. What that means is the brain is able to build up, even if you have damage, disease, building up in the brain, that there's something called cognitive reserve that allows you to still function despite having that injury or disease in the brain. Cognitive reserve is built up through social engagement, educational experiences, especially in early life, but this can also be built and maintained in older age. That means that it's never too late to build and maintain cognitive reserve. That also has implications for how can we detect earlier cognitive impairment? How can we have a better understanding, especially in older age? But remember, this evolves across the lifespan. So, even still, just a little piece of evidence here that even with individuals who were genetically at risk for developing dementia, especially Alzheimer's disease, if they were frequently engaged in social activities in later life, they had a decreased risk of developing dementia. That's big. If you look to the left, you will see that years of education, social network, so the larger your social network size, but then especially at the bottom, what they're calling leisure activity scores, that's social engagement. So this is accounting for up to 64% of your cognitive reserve, meaning that even if you are to develop pathology, even if you are to sustain an injury to your brain, that having more frequent social engagement can thus build up your reserve to be able to stave off dementia or cognitive decline. So something else that we go back and forth in the scientific world is it's rare that social engagement exists on its own. So it is a distinct component of a healthy lifestyle, particularly in older adults. But it's usually involved with what I mentioned earlier, the three acts. So it's one of three, obviously, social, cognitive, and physical activity. And many of these social engagement pieces contain more than one component. So if you think about a favorite activity of mine, yoga, that involves being in a group, so being with others, so social activity. We're consistently doing this. I find it beneficial to myself. I'm seeing these individuals very consistently, but I'm also engaging in physical activity, and some may argue cognitive or mental stimulation. I have to remember the poses, remember how to do them, and then how to move in unison with others in particular. So there's a concern that there's a particularly low impact of social engagement on its own, that it must be included with either cognitive or physical activity. Here, I wanted to investigate that, especially on before we get to dementia or cognitive decline. What is something that may show a signal in terms of diminished cognition a little bit earlier? And that's something that we call decision making. How do you make various choices around your healthcare and finances? How does cognitive activity, social activity, and physical activity, singly and in tandem, impact your function here as well as your decision making? And we find that it was only late life cognitive activity, so engaging in mentally stimulating activities, going to the museum, reading a book, engaging in conversation with others that's really about a topic that you may be debating about, those things really impacted your decision making, particularly in older age, and it was most beneficial for people with lower levels of cognition. That's still very key, however, that these are non pharmacologic, so lifestyle pieces that can benefit your brain health in older age. But that's not enough to have one piece of evidence. So I'll walk you through this very big graph here. So if you'll see at the top, you'll have cognitive activity, that's the mental component, highly impactful even on its own. The same for physical activity and social. So that means for each of these three acts, social engagement, physical activity, cognitive activity, all had the more you do them, the lower your dementia risk. The more you do two of them, the lower your dementia risk. But the biggest piece is all three. So engaging in all three cognitive, physical, as well as social activities very frequently has the biggest bang for decreased dementia risk. So all of this has been quite positive and very encouraging. So I did want to put a note on loneliness and social isolation. So social engagement and loneliness can coexist. So I could be taking part in these activities with others, something meaningful, and still be quite lonely. So we know that this is equivalent to smoking 15 cigarettes a day, but also is associated with cognitive decline. So think of it as the opposite type of relationship with social engagement. But really, social engagement is the opposite when we think about it in research from social isolation. So if you're engaged, you're not isolated. But if you're isolated, you're not being engaged. That's whether it's virtually, in person, no matter. And social isolation being linked to cognitive decline as well as cognitive impairment. So we're really focused on how can we have social interventions to facilitate preventing and reducing risk for cognitive decline through a reduction in social isolation. So one way that we think that isolation impacts cognitive health is through perceived stress. That no matter, say, if you're isolated, engaged, social isolation is a predictor of higher levels of perceived stress that we know is linked to deleterious outcomes from dementia risk, early all-cause mortality, and morbidity. Now, I spoke about pretty robust body of literature around social engagement and its support is pretty strong. We see this in cross-sectional, so one point in time, and longitudinal over time observational studies. This is very strong. It's key across the lifespan, so say in early age, midlife, later life, but evidence stronger in mid and later life, and needing to maintain these levels into older age. It's useful across the cognitive spectrum. So whether you are cognitively healthy, whether you're experiencing decline or impairment, social engagement is key and even beneficial for persons living with dementia. And a particular mechanism may be cognitive reserve. But I'll walk you through this sort of a dense slide, is that there is less compelling evidence for social engagement. Despite its importance, less research has focused on social engagement, particularly in older age. Two, how are we defining and measuring this? There are so many different terms: social engagement, activity, isolation, loneliness. What do we mean when we say engagement? How are we measuring it? And more importantly, what do people think of when they're thinking through engagement? And what does it mean to them? And which activities are of most benefit? And then moving on to the research piece, even more so, is there's fewer randomized controlled trials, RCTs, intervention studies to understand, is it that individuals who have higher cognitive impairment are less socially active, or is it people who are socially active have less cognitive impairment and decline? Secondly, what's the impact of social engagement all on its own, regardless of physical activity, cognitive activity? And then also, how are these three pieces interrelated? And delving deeper into cognitive reserve and resilience, as there are individuals who just don't get dementia, may not experience steep levels of cognitive decline. How does social engagement play a role in that type of healthy outcome? Then also, a lot of our work is not describing who's in our studies. So I tried to place on the slides exactly who were the participants. So what are their demographic characteristics? But a lot of this work does not include individuals for what we call priority populations, especially in older age. So think women, older Black adults, older Latinos, other members of minoritized racial and ethnic groups, members of the LGBTQIA plus community, and especially those in rural populations, to say nothing of the intersections thereof. And then lastly, a note on midlife social engagement. As we're moving from midlife into older age, many people retire. A big piece of midlife social engagement is through your job, your work. What happens to those relationships? How do they impact social engagement in later life? And even more importantly, how do they impact healthy or successful aging? So I'm outlining strategic next steps. There are many communities, many people who are living healthfully all around us. There are many individuals who have social engagement, social activities that are community based, that benefit others, that benefit themselves, and may build up cognitive reserve. We need to be able to say, what are these different activities? Where are these individuals and what are they doing? So identify and leverage, say, what are the different types of social engagement efforts that are taking place all around us, scale them up, particularly through collaboration with other scientific and lay communities. That means leveraging, say, for NIH funded Alzheimer's disease research centers. How can we work with their outreach, recruitment, and engagement cores? How can we develop a network of community based leaders that we can facilitate healthy aging, especially through the social engagement efforts that they're already doing through their churches, through their civic centers, through their sororities, fraternities, etc. And then lastly, being able to say, how can we take that, have randomized control trials, intervention studies, and other evidence based related practices to be able to reach a broader impact of people? Recognizing who is at risk, where do these individuals live, what are their demographic characteristics, and be able to create and tailor these different multi domain lifestyle interventions, strategies, and education materials so we can focus on positive aging trajectories for all older adults, diverse older adults. So, in sum, social engagement should be encouraged to preserve cognitive health. This is throughout the lifespan, particularly from midlife into older age, especially in older age, focusing on these priority populations for little or less is known women, minoritized groups, LGBTQIA plus communities, and persons living in rural areas. Also, note that social engagement is likely interconnected with cognitive and physical activities, but we especially need to level up and, well, first identify, then level up and collaborate on evidence based practices and macro or structural level strategies regarding social engagement to diminish cognitive decline, cognitive impairment, and to ultimately bolster positive aging for all for adults. These are my acknowledgments, especially to faculty and staff at the Rush Alzheimer's Disease Center, the diversity of community members engaged in the research that I conduct, as well as just all overall. And please send along your thoughts and questions. My only regret is that I could not be there with you in person, I guess live today, but my email is always open. You can find me on X, also known as Twitter. So thank you. Thank you so much for listening. Please reach out, and I look forward to positive aging with all of you.
Thank you so much, Dr. Glover, for such a wonderful presentation. I did have a few follow-up questions. I would like to know if you could re-highlight some of the strategies that could be implemented in the community to promote social engagement, that would be great.
Thank you for that question. I think there are social engagement efforts going on all around us. I think the key piece is getting connected to them. So, identifying what you're interested in, what's a particular goal that you may have, an activity, and then seeking out near you what are opportunities to engage in those. Who's doing it, say, in your neighborhood, in your building? What does that look like? Also, being able to visit your local Alzheimer's Disease Research Center, if that's around. The outreach, recruitment, and engagement cores are always a wellspring of information on what's going on in the community, who's doing what, and how. So, really, I think what I'm saying is identifying and knowing what you would like to do, being able to reach out to individuals who may be taking part in those activities, and doing so through local research centers, churches, civic places, fraternities, sororities, other locations to say, hey, this is what I'm interested in. Can I join? And can we do this together? But that's a huge step because Sometimes you're shy. Sometimes you don't know where to start, when to start. What do you even want to do? So I always emphasize knowing what you want to do is the first step, and then being bold enough to say, all right, what are some listservs, whether on Facebook? What are some postings at the local church or community center? And just also just being bold, I guess, is in your title, and say, how can we do this together?
Awesome. Thank you so much for sharing those strategies that can be utilized in the community. And then one final question that I did have for you is, we recently were notified that there is a new socioeconomic journal that was released. Could you please highlight on that resource?
Yes, I am so excited about this new journal. It's the newest and fourth scientific addition to the Alzheimer's and Dementia suite of journals. So that's hosted by the Alzheimer's Association. It's called Alzheimer's and Dementia Behavior and Socioeconomics of Aging. So the journal is focused on examining and applying. So, how can we apply different strategies? So, what we're talking about here to facilitate healthy aging, but really to examine and understand and apply these findings to diverse aging trajectories. So we're thinking of behavior at the individual level, sociocultural aspects, that's at the community or institutional level, and then economic, especially policy at the structural or larger element area. I think that is so exciting. I cannot wait. Our website went live last week at the Alzheimer's Association International Conference. So we'll put that in the chat, the website. It gives you the scope and aims, who's on the editorial board with myself being editor in chief. I'm very excited. And also how to submit your different scientific contributions if you so choose. So that's something we, meaning me, myself, the board, and the association, and the other Alzheimer's and dementia folks are very, very excited about.
That's so wonderful to hear. We'll be really excited to share that resource. We'll also include that resource in our email recap, as well as make sure that link is added in the chat. I do want to thank you so much, Dr. Glover, again for joining us today, and I hope you have a great rest of your day.
Thank you so much.
Awesome. So it was so great to hear from Dr. Glover, but I did want to highlight if you have any questions for her, please do not hesitate to shoot her an email or message her on X, and that way she can get your questions answered. So without any further ado, let's see. I would like to highlight the journal that Dr. Glover mentioned. It is the new Alzheimer's and Dementia Behavioral and Socioeconomics and Aging Journal. Kat, my colleague, is going to drop that link as well as the email as well as X for Dr. Glover. And now I'm going to turn it over to Patty and Maya so that way we can hear from our Minnesota Department of Health folks about the work that's being done in the community.
Hi, everyone. Thanks, Dr. Glover, for such an informative, interesting presentation. It was a good way to kickstart this conversation about what we're doing in Minnesota. My name is Patty Takawira, and I lead our Aging and Healthy Communities unit in our Center for Health Promotion at the Minnesota Department of Health. And I help coordinate our BOLD grant in Minnesota. Pass it to Maya.
Hi. Yes. Hi, everyone. My name is Maya Kashkahar, and I lead the community engagement work, the Aging and Healthy Communities unit at the Minnesota Department of Health.
Great. We can move on to the next slide. So today we're going to start just by talking a little bit about what opportunities we see in Minnesota to address social engagement barriers, and then move into how we at the health department and then many of our partners are addressing social connection and social engagement, and then jump into a little bit about what we see moving forward for that work. Next slide, please. So we don't have a great way to measure social connection in Minnesota yet, but we have used some data from our state behavioral risk factor surveillance system, or BRFIS, to look at some data to try to understand the issue. So we do know that Minnesotans are reporting that they have insufficient social and emotional support, along with other dementia risk factors. And though this table does not list all of the groups that have a higher burden of dementia or healthy aging risk factors, it does demonstrate how these factors are more common among Black and African Americans and American Indian populations in Minnesota. So overall, 17% of Minnesotans are reporting that they have insufficient social or emotional support, and those rates are much higher in other population groups, in the American Indian and Black or African American groups specifically. And so we see this as a huge issue, and this data is compelling to us. And the social and emotional support risk factors aren't the only ones where we're seeing higher rates and inequities. So this is an area for us that we keep coming back to as a reason to really focus on this work with our BOLD grant and other funding. Next slide, please. We also see with our behavioral risk factor surveillance data that Minnesota caregivers are needing more support as well compared to non-caregivers. For most of these measures, the rates are a bit higher for dementia caregivers specifically as well compared to caregivers overall. So Minnesota caregivers are more likely to report having 14 plus poor mental health days per month compared to non-caregivers, and 3 in 10 caregivers report needing additional support in their caregiving role. And digging a little deeper, the rates of smoking and history of depression are also higher. So again, another opportunity to support caregivers in multiple areas, including with social and emotional support, which is kind of a proxy measure we're using for social connection and engagement at this time. Next slide, please. And this is kind of just to reiterate some of the things that Dr. Glover shared, but just to note that social isolation is not a normal part of aging. This is something we're trying to promote in Minnesota. While aging is inevitable, issues like memory loss, uncontrolled chronic conditions, falls, social isolation, and depression don't have to be. And just, frankly, the older adults in our communities bring too much value to not intentionally engage them in all the areas of community life. So this is sort of a value for our team and that we're trying to promote statewide. Next slide, please. So one of the ways that our state is addressing this issue is through our multi-sector blueprint on aging. Our state has an age-friendly council made up of different state agencies, and they've been building a 10-year plan that's bringing together state, local government, philanthropy, and the private sector to plan for this demographic shift. And 4 domains have been identified. One of those domains is connected communities. And within that connected community domain, strategies include building public spaces for all ages and seasons, as well as social engagement. Right now, this group is building out the tactics for each of these strategies. And we know that there's strong interest in digital equity and engagement for older adults, in addition to the development or enhancement of public spaces for all ages and seasons. So those are some of the things that we expect to come out of the blueprint. But this is really, it's multi-sector. There's been a lot of community engagement in the blueprint strategies and tactics. So this is sort of a start, a roadmap for our state. And we're glad to see that this domain of connected communities is a big part of the plan. Next slide, please. Age-Friendly Minnesota also has a community grant program. And these are just grants to community organizations, local government, and others that are promoting age-friendly efforts in diverse ways. In this last cohort of age-friendly grants, there were at least 9 grants that focused on building social or intergenerational connections. And some of the ways that grantees were doing that included multi-generational projects that were led by school districts. So some of those like shared use policies for the gymnasium, strategies like that, strengthening connections and communications across the community to increase engagement and social connection, different types of culturally specific community engagement and listening sessions, trying to understand what community needs, and then increasing opportunities for fitness, recreation, and social connection. Next slide, please. This slide is focused on our work at the health department. Our Healthy Brain Initiative was initiated with CDC Bold Grant funds. And through that initiative, we initiated our Minnesota Dementia Strategic Plan. And the strategic plan is aligned with the CDC Healthy Brain Roadmap, following these 4 domains or areas. So educate and activate, developing policies and mobilizing partnerships, assuring a competent and culturally responsive workforce, and then monitoring and evaluating. The strategic plan includes strategies like uniting communities and organizations to co-design, lead, and implement collective action, and ensuring that the Minnesota strategic plan incorporates and is led by the voices of those at highest risk of dementia, those living with dementia and their care partners. We engaged the Minnesota Healthy Brain Partnership, which is a group of statewide partners working to collaborate and coordinate dementia-related efforts across the state. And they helped initiate the strategic planning process. And with that group, we engaged 2 different strategic planning work groups, a community work group and a data to action work group, that were able to help us refine the strategic plan, really making sure that the plan was relevant to community, included community voice, was in plain language, and just something that had community buy-in, and that the strategies would be reflected in our community grant request for proposals. In our 2023 legislative session, we were with the advocacy of our local chapter of the Alzheimer's Association, we received some state funds to begin an Alzheimer's awareness campaign. And the campaign is really focused on culturally responsive awareness. And we're still in our first initial phase of this campaign. And our first phase was really to create and work with community to identify tools for a community toolbox to be used by community-based organizations to increase Alzheimer's awareness. And then I want to pass it to Maya to talk more about our MDH Healthy Brain Community Grant Program.
Thank you, Patty. So for this community grant program, it's funded through the CDC Bold grant, and we have 5 community partners. And our community partners, so the bullet here really lists kind of a spectrum of different activities that community partners are focused on. They really are using culturally specific approaches, integrating art and theater to start conversations about brain health and dementia. We're partnering with faith organizations who have translated and disseminated information about dementia and Alzheimer's. And then one of our partners is entering into the beauty barbershop space to provide dementia education training about risk factors. And in addition to the conversation about risk factors, it's also connected to other chronic diseases and illnesses. And then all of our partners are supporting caregivers and care partners, especially promoting programs that really emphasize social connectedness and engagement. Next slide.
So Dr. Glover also talked about tailoring initiatives to specific communities. And in 2023, we were also awarded the CDC Closing the Gap with Social Determinants of Health Accelerator grant for a year-long planning process to create an implementation-ready social determinants of health plan with a community. And we are working with a group of community leaders in the Rondo neighborhood of St. Paul. Rondo is a historically Black community that was torn apart by the construction of Interstate I-94, which was an example of the structural racism that happened in Black and Brown communities across the nation. So we are bringing community leaders in Rondo together with the help of a facilitator to focus on some existing community-led strategies to reconnect Rondo and revitalize social cohesion in the neighborhood. So there's so much work going on in Rondo. We're really just trying to get it all in one place together with the community leaders so we can identify more resources to implement some of the strategies that the community has already identified. So some of the big partners are on this slide here: Reconnect Rondo, the Rondo Center for Diverse Expression, the Rondo Roundtable. This is just a year-long planning grant that's almost done, but we were able to identify some funds to begin implementation, to support implementation of some of the identified activities from this plan with the Rondo leadership team. So this is an example of a place-based planning with a focus on social connection in the built environment. Next slide, please. Another key partner of ours is Trellis, which is our metropolitan area agency on aging in Minnesota. And they have three big dementia-related initiatives: the Remember Project, Dementia Friends Minnesota, and Act on Alzheimer's. And all of these different initiatives touch on social connectedness in multiple ways. The Remember Project is a kind of an initiative of Trellis, and it uses theater, specifically one-act plays, to raise awareness about dementia. And then every time that either a virtual or in-person play is put on, there's a community conversation that builds connection and support for caregivers and people living with dementia. So it really brings folks together to have some kind of raw conversations and connect with each other. And then through Dementia Friends Minnesota, and in partnership with the Remember Project, Dementia Friends staff conducted a series of interviews with older adults about social isolation, and then they turned those interviews into monologues, had them acted out, and recorded them. And at the annual Dementia Friends Summit this October, those monologues will be shared publicly, and there'll be community discussion around them. So it's really kind of initiating a conversation with dementia partners across the state on social isolation. So really excited to support that summit and kind of learn more about the discussion that comes out of that. It's a pretty cool project. Next slide, please. And then finally, another key partner of ours, the University of Minnesota Center for Healthy Aging and Innovation, is focusing on social connection in a couple different ways. One is through the ALTER program, which is a nurse-led collaborative to address the lack of dementia resources awareness in African American and faith communities, led by Fayron Epps. And in Minnesota, this project is led by Robin Frazier. And the initiatives with the partners engaged in this project, with the faith-based partners engaged, is are support, education, and worship. So support, they're focusing on offering support resources for care partners and people living with dementia. Education, they're providing faith-based and community education and awareness opportunities. And then in terms of worship, offering an inclusive or modified worship experiences for people living with dementia at least once a month. So those are 3 of the key initiatives for Alter. And there's a QR code there on the screen if you're interested in learning more about the Alter program in general. And then the Center for Healthy Aging and Innovation, or CHI, has a community advisory board. One of the projects that the community advisory board identified had to do with multicultural gathering spaces. And so they decided to conduct a community program assessment with the goal of developing a proposal for a program that would provide space for diverse elders to connect and promote healthy aging, as well as offer intergenerational activities. And so they're in the phase where they've conducted over 150 surveys and then are developing a report to summarize their findings and provide recommendations on where and what type of additional program is needed in the community to reduce social isolation and loneliness. So we have kind of multiple initiatives going on at the same time. But I think in Minnesota, what's working well and with support from CDC Bold is bringing us all together in one space where we can share what we're doing and understand our connection and alignment and how it relates to dementia risk. So moving on to what's next. Next slide, please. We plan to continue convening and collaborating with our Minnesota Healthy Brain Partnership and other partners to implement our dementia strategic plan through collective action, continue to advocate for funding to support locally led solutions to address social isolation, like our work with the Rondo leadership team, and advocating for resources to collect, analyze, and disseminate data to guide public health action. Like I said, we don't have a great way of measuring social connection at the moment. And then learning from approaches in other states. So learning from all of you about how you're addressing social isolation and building social cohesion in your states as well. Maya, do you have anything to add? All right, these are our email addresses. If you want to reach out to us, we would love that. We'd like to collaborate with other states and learn from them. So thank you for being here today.
Awesome. And thank you so much, Patty and Maya. We greatly appreciate you joining us today. And of course, we always appreciate being able to partner with the Minnesota Department of Health. So as we go into the Q&A portion, we do ask that if you have any questions for Patty or Maya, please put them in the Q&A box, as well as if you have any questions specifically to Dr. Glover, please reach out to her email as well as her X account, previously known as Twitter. Or what you can do is you can wait for the recap email, and we'll be sure to make sure that all that information is in the recap email with the recording and additional resources as mentioned. I'm going to call on Kelsey or Kat. Would you be able to let me know what questions we have in the Q&A box?
Yes, and thanks so much for that great presentation. It was really great to hear about the conversations you all are having in the community about brain health. What advice would you give to folks in the audience about how to really start those conversations about brain health?
Well, if we're talking about kind of at the community level versus interpersonal, I think maybe what we've learned from our community grantees is starting with an understanding of kind of what the community knows or thinks or understands about brain health. So what it is, I mean, we've learned that in some of the communities prioritized by our community partners, there's not even a word for dementia or really a concept of brain health that is like commonly recognized or understood. And it's hard to promote brain health or support caregivers without that sort of foundational awareness work. So that's been sort of a strong area of work for us to support, is just the foundational educational kind of training and awareness building in a culturally responsive way. Maya, anything to add?
Yeah, and I want to add that I would say start with trusted messengers in that community, right? Whether if it's a rural community or a specific racial and ethnic community, right? It it's really important to start with trusted messengers, especially as you're getting the word out or doing a lot of education or training around brain health, right? If it's coming from those trusted messengers, it's going to be received differently.
Great, thank you so much for that feedback. So going into some of the other questions in the Q&A, Patty, I think in one of your earlier slides, you were talking about connected communities, and one of our audience members was wondering if there is a specific definition of what is a connected community.
Oh, I don't think so, but I felt like Dr. Glover was giving some great definitions of what social engagement means, and that was really useful for me to think about can we say these things and what do we mean? So it's kind of the same with brain health. Like we just talk about advancing brain health, and we don't always have a great definition for what that means too, like as it relates to mental health, or is it something different? So I really appreciate that question. I mean, I think I have my own definition of what that means, but in terms of a broad definition for our state or our nation, that might be emerging work.
Yeah, I would agree with that. I think it's emerging work, and the group that's working on the blueprint will be, my guess is they will be the ones helping to put some meaning behind that term.
Yeah, I guess the one thing I do know is that we also have this aging task force, a legislative task force on aging that's meeting right now and developing recommendations. And those conversations have really focused both on digital connection, and so like a lot of talk about broadband access as well as physical spaces. So I guess I can share that, they're really thinking about it more holistically, like all the different types of ways to stay connected.
Thank you so much. Our next question is about the chip. So someone was wondering if the information about this is included or has it been integrated into your chip?
Are you saying CHIP?
Yeah, community health
improvement plan. So in our state community health improvement plan, I guess what I can say is that social connection and social isolation are becoming a very kind of like widespread agency-wide concern across lots of different divisions and bureaus of the health department. So from like mental health and well-being to our aging department to suicide prevention, our health equity bureau, like all the different areas, it's becoming a kind of a hot topic or an area, like an emerging area for us. And I think our statewide health assessment is probably one of the reasons why, because there are a lot of there's community feedback about social isolation. And we also have an assessment that was led by an initiative of our Minnesota Leadership Council on Aging's Diverse Elders Coalition. It's a needs assessment of diverse elders that really highlights the need to address social isolation in diverse communities as well. Any other thoughts, Maya?
No.
And Michael, I know we're getting close to time. Do we have time for a couple more questions?
We have time for a few more.
Okay, great. So this next question, someone's asking about the Dementia Friends Summit, and they were asking if that is a national event or something that you facilitate in Minnesota with your Dementia Friends or Dementia Friends champions. They're interested in initiating something like that in their state.
Yeah, so I mean, there's a part of that summit that is virtual. The initial presentation, I think, Maya, correct me if I'm wrong, but it is more of a state effort and in collaboration with Dementia Friends across the state. But Minnesota has a really strong Dementia Friends program, and I know are happy to connect and collaborate with anyone interested in learning more about what we've done in Minnesota and our strong network of dementia friends and act on Alzheimer's communities.
Great. Thank you so much. Our next question is asking about your funding source. So what was the funding source that enabled you to provide funding for your age-friendly efforts with communities?
So the age-friendly work.
Responded. Oh, sorry.
Oh,
I was just
respond?
going to say, I think I responded to one of the questions about funding.
Okay.
Oh, no, never mind. That's a different one.
Okay.
So I just responded in the chat. Yeah. Go ahead.
Yeah. So the age-friendly effort. So the age-friendly council was a governor's initiative, and so that funding is state funding, and that work is actually it's a a multi-agency council, but the work is led by our Department of Human Services, Minnesota Board on Aging. But yeah, that's not bold funding or federal funding. That's state funding. And there's, again, like, we have this legislative task force on aging that's currently trying to figure out, like, how are we going to address this statewide, long-term, and what recommendations do we have for doing that in a sustainable way. So those are slated to come out in January 2025. And I think a lot of state agencies are engaged that process, from transportation and housing and DHS and MDH and a lot of other state and community partners as well.
Awesome. Thank you all again for joining us. And unfortunately, we are running low on time. So I'll go ahead and reshare my slides so that way we can go ahead and close out today's session. So here you will see this is another opportunity, not just for local health departments, but also for public health professionals. We do have the launch of our Understanding the Public Health Impact of Dementia curriculum that is available. And we'll go ahead and have our launch on September 5th from 3 to 4 p.m. Eastern Standard Time. We do have a registration link that we will be sure to drop in the chat, as well as you can scan the QR code here. But as a reminder, in the event you're unable to capture either the link or the QR code or any of the resources that were discussed today, we will be sure to include it in the recap email. And then lastly, if you could sign up for the e-news just to stay connected on what resources are coming out of the Public Health Center of Excellence on Dementia Risk Reduction. This can be found at alz.org/risk reduction or alz.org/risk reduction. And lastly, this is the third webinar of this entire series. So we will be hosting our fourth webinar September 25th at 3 p.m. to 4 p.m. Eastern Standard Time. We'll also hear from Dr. Ganesh Bhupal, Associate Professor of Neurology with the Washington University School of Medicine. And we'll also hear from Nina Sase, Director of Policy and Planning with the Michigan Department of Health and Human Services. So please scan the QR code, register for our final and fourth webinar of this summer series, as well as connect with us with our e-news so that way you can stay up to date with all of the amazing resources that are coming out of the Center of Excellence on Dementia Risk Reduction. And then lastly, there is a form as you exit this webinar. We appreciate 2 to 3 minutes of your time to just let us know your thoughts of the presentation, as well as if there are any other opportunities or resources you would like to see come out of the Dementia Risk Reduction Center. And again, thank you all for attending. Thank you to our speakers, and I hope you all have a great rest of your day. So please take care.